about 1,500 clients that rely on us each day that call in. We had a chance to meet some of those incredible staff upstairs. And our goal is to really be the nexus, to really help people with a human connection, getting them connected to the services they need in the most dignified way possible. But what we also do in those interactions is look at all the stories and all the data and try to inform our leadership in our community, statewide and nationally, about what issues are facing us and what maybe policy decisions can be changed to improve the health of our community. So it's with my honor. My name, by the way, is John O'Hanian. I'm the President, CEO, and honored, humbled leader of this organization. And one of our dear long-term supporters is here, Assemblymember Todd Gloria. Thank you.
Go ahead. Thank you, John, and good morning, everyone. Thank you so much for coming to 211. John was being characteristically humble. This is an incredible facility, and I'm so glad that our governor got to see it firsthand. I think this is really a prideful point for those of us that really want to connect the most vulnerable in our community to the services that we work on. And that's exactly why we're here today. Starting off, of course, by thanking Governor Newsom for making the trip to San Diego. Those of us in San Diego sometimes worry that people in Sacramento don't know that there's world south of Orange County. This governor knows that the second largest city in the state is right here, south of Orange County. Thanks in no small part to my partner in the legislature, our Senate President Pro Tem Toni Atkins. But in all seriousness, Governor, thank you so much for being here. We love having you in San Diego. It is under the leadership of Governor Newsom and Senate President Pro Tem Toni Atkins, as well as our Speaker Anthony Rendon, that we're able to be here today to explain to the public that the significant expansion and access to quality health care through this year's state budget for some of the most vulnerable populations in California. This includes $98 million to expand full-scope Medi-Cal coverage to eligible young adults ages 19 through 25, regardless of their immigration status, starting on January 1st, 2020. That means that 90,000 additional Californians, our neighbors, our schoolmates, our family members, will now be receiving full-scope coverage under the Medi-Cal program because of this exceptional public investment. But personally, I'm most proud of the fact that this is the first in the nation commitments that we have made for making health care coverage affordable to California's working and middle classes. In the next fiscal year alone, $428 million has been set aside to provide subsidies for individuals between 200 and 600% of the federal poverty level. And that includes individuals at or below 138% of the federal poverty level. This figure will grow with time to make sure that we can keep up with the demands and expand the access to critical health care coverage. That's over time, over $1 billion more to help low and middle income Californians afford the health care coverage in the Golden State. This means the kind of stability that families throughout San Diego, but I'm thinking about families making about $80,000 a year living in our neighborhoods who may not currently be receiving coverage from their employer, but as we know, don't earn enough or earn too much to qualify for Medi-Cal. This helps fill in that gap. We're talking about the missing middle all the time in Sacramento and here in San Diego. And through Governor Newsom's leadership, we're making good on the progress of making sure our working people come first in California. These long-term improvements in health care are inevitable because of these investments, and that's why I'm grateful so many of you are here to help us get that word out. The families who have spent way too many nights staying up around the kitchen table trying to figure out how they're going to pay for their rising health care premiums, their rent, or their car payments, this budget provides immediate relief for those folks, for those long-term concerns that they've had. We hear you, we see you, and we're doing something about it. I'm proud to stand here with our governor and with Senator Atkins right here at 211 San Diego, who will also be an invaluable asset in making sure this message gets out to those who are now eligible. This center alone has educated over 70,000 consumers about the options available under Covered California, helping to balance the pool of insureds of healthy and younger individuals. We are on the path to ensuring that every Californian is healthy and has a roof over their head at the price that they can afford. This is only due to the leadership of our Senate President Pro Tem, our Speaker, and of course our Governor. And Governor, thank you again for helping to draw attention to this important state investment. I'm so proud to stand here with you in support. And with that, it's my pleasure to introduce. I get to talk and then I get to introduce. This next one's a little more important. To introduce, most importantly, my friend. Also happens to be my senator, but happens to be all of our state Senate President Pro Tem. She is the pride of San Diego, truly the pride of California, Senator Toni Atkins. Toni?
Well, good morning, everyone. It is so wonderful to be here today to talk about some positive things going on in the state of California. To John Ohanian, Bill York, 211 San Diego, this is an incredible organization, but I also see a number of the nonprofits here today for this announcement and this conversation with our governor that really are the backbone of what we are doing here in San Diego County with, of course, the leadership of our governor and the support at our state. Millions of families rely on Covered California for their health care. California embraced the Affordable Care Act from the very first moment because we knew that health care was a critical need and a priority issue for our families and our citizens. That's why this year our final budget, as my assembly member said, invested more than $450 million in increased premium support for middle class and lower income Californians. We heard you and we responded. Thanks to this investment, there will be lower cost premiums for middle income Californians with income equivalent to about $150,000 for a family of four. So when Todd talked about Todd, Assembly Member, the missing middle, that's what he's talking about. This is real for people in our communities. And so we're cutting the cost of health care for middle-class families by more than $170 per month. That's real money. And thanks to this investment, Covered California's rate increase will be below 1%. That's incredible when you look at what's going on across the country. This investment is due to the leadership of our governor, Gavin Newsom, for proposing this approach in his very first budget. And I want to acknowledge, of course, our Senate budget and our Assembly budget leaders who really came together to make it happen. But it was the leadership of our governor. After decades of careening from budget crisis to budget crisis, we've turned our state finances around and have made necessary new investments to shore up our battered safety net. For example, we not only have a rainy day fund and reserves of upwards of $19 billion. Part of that is $900 million in a health safety net reserve, so that if and when we start to see things look a little dire in our economy, we have set aside money for Health and Human Services, and that's under the leadership of our governor. I want to say this is a commitment to continue to help as we reinvest and support our residents in California, that we're also being fiscally prudent and we're making sure that we have those reserves for when we need it. That's in addition to our investment for tax cuts for small businesses, increased investments for K through 12 and higher education, as well as tax cuts for working families through our increased commitment to the Earned Income Tax Credit. It's evidence of the commitment to strengthen our middle class. And guess what? San Diego's 211 leads in making sure people understand that Earned Income Tax Credit. So that's what we're here to talk about, all of the resources, but particularly around Covered California. And now it's your turn. I'm so glad the media is here and the people from the organizations that make it happen with our residents, because your turn means that to have the healthiest California, we need everyone eligible for Covered California to sign up. Open enrollment starts October 15th and runs through January 15th. And that's really an important message to get out to all residents, and that you could have that additional subsidy. So between now and then, Governor Newsom, our colleagues, we're going to be a broken record. And I know some of you got to Google that to figure out what that means. But we're going to continue. We're going to continue to get this message out because it is so important. It is my pleasure to welcome back yet again to San Diego our incredible governor. We're always thrilled to have him here. Your being here is a sign, and I heard your comments as we did the tour, of that NorCal, SoCal rivalry is over.
That's right. That's right.
San Diego and San Francisco will always have the Dodgers to keep us together. Governor,
That's good.
thank you.
That was good. That was like really good. I hope you guys got that on tape. That was no truer words I've ever heard. God bless. Well, thank you. Both of you were fabulous, and I kind of feel humble. I don't know what else I can add to the conversation except some gratitude. And to all of you that are here. Thank you for the great work you're doing. Thank you for the partnerships you have formed. John, thank you for enlivening all of us in what's possible. There's the old adage, once a mind is stretched, it never goes back to its original form. I had the privilege a number of years ago to come here to the 211 Center, and I have increasingly become frustrated that we're not seeing this model replicated in other parts of the state. This is a remarkable project that you have undertaken. It is an incredible example of what's possible for other counties all across not just the state, but across the nation. And it's incredibly important that we're here in context to what we're promoting on health care. I've long understood in my time being a county supervisor and mayor, and now as your governor, that just passing a law or passing a program doesn't in and of itself solve a problem. In sort of easier terms, program passing is not problem solving. Once a program is passed, you got to raise awareness around it. You've got to enforce its provision. You've got to get the word out and make sure people are signing up. And that's what 211 is all about. It's about forming those connections, expanding partnerships. It's about resourcefulness. And that should unite all of us. It's not about spending more money. It's about leveraging existing resources and connecting them to those most in need. So thank you, 211, for all the extraordinary work you're doing. And I want to thank the legislature, the pro tem. She is being humble, as Todd said. What an extraordinary leader you have here in San Diego. You know that. The rest of the state knows that. And it's such a gift and treat for me to be able to work in partnership and collaboration with someone that shares the same values that I think overwhelming majority of us do. And someone's not just dreaming, but doing. And that practical application this year was at a scale the likes of which no other state in America has ever seen. What you just heard from Assemblymember Gloria and the pro tem is something you're not hearing in any state in America. I want to make that crystal clear. No state in the country is doing what California is doing on health care. That expansion into the middle class is a big deal. It's interesting how much attention, I get it, and it's understandable, that was given to the expansion of health care regardless of your immigration status. But it was equally remarkable is how little attention was given to the expansion of our subsidies into the middle class. $172 a month of subsidies for families of four earning up to $150,000. For an individual earning up to $72,000, those subsidies are now in place. Those are folks earning up to what we refer to in the language of politics, 600% of federal poverty. No state has gone that deep into the subsidy expansion. No state has gone deeper into expanding for people earning 200 to 400% as well. And that was another commitment that was advanced in this budget. $2.1 billion. That was the expansion when you get the matching federal funds in increasing our Medi-Cal reimbursement rate, which has traditionally been one of the lowest in the nation. We're now making progress to get out of the bottom and to move more appropriately to encourage more of our primary caregivers to provide that quality access to those most in need. I could go on with a dozen plus other things we did on the budget on health care. I would be remiss, though, not highlighting one, $100 million for reproductive care, which was a point of pride in principle, in contrast to the assaults on reproductive care that we're seeing out of Washington, D.C. California is standing tall, and we are standing, I think, firmly on our values. And I cannot be more proud of the partnership that we have in the legislature. One brief final point. We have more work to do. None of us are naive. Our goal is universal health care. We're not there yet. ACA has been an incredible tool, and the ACA in California is proving itself in remarkable ways. We were at 17.2% uninsured rate in 2013. The old numbers we have, I'm waiting for the new ones, go to 2017, it's just 7.2%, close to a 60% decline in that uninsured rate. But we're not naive at the backdrop of a court case that the White House is supporting enthusiastically. It's to dismantle all of that progress, to roll back all of the pre-existing care protections and the health subsidies and expansions. That is an existential threat to the economy and quality of life and health of Californians, to all of us. You may think you're not part of that. You are. You dismantle the individual mandate, your premiums go up. Because we enacted our own version of the ACA by extending that mandate, we saw, as the pro tem said, a 0.84%, less than 1% increase this year in our premiums. Had we not done that, we would have seen what we've seen over the last 5 years, and that was an average 7.9% increase over the last 5 years, less than 1%. But here's the punchline, and I will conclude with this. You have done even better here in San Diego County because of the extraordinary work of 211, because of the extraordinary diversity in your risk pool, and the great work of the 7 partners in Covered California. You are seeing, in essence, 0% increase. It's 0.2, to be precise, increase in your premiums. In many cases, people will see an actual reduction if they follow some of the recommendations of 211. There's some estimates, Mr. Secretary, that we could see if people sign back up and get these lower cost plans, as much as 11.4% decline in premiums. You can PolitiFact this if you choose, in those annual costs. That's because of the extraordinary work of all of you here today. So congratulations, San Diego County. Thank you to the leadership of the state of California for their work, but again, sober in relationship to what's going on in Washington, D.C. and a federal court in Texas, and with the work we have left to done to cover so many more Californians. Thank you all very much for your attention, and we are happy to take any questions on this topic. We, of course, may indulge you on others, but we're happy to take them on this topic.
Governor, so the way people would get these subsidies is they would call 211, or if they were going to go on the website.
John, get up here. You were just regaling us with exactly the response to that.
We encourage people to know that 211 is here 24/7. We are here to connect people to lots of different services. I think what ends up happening is people out in the community call us for various reasons. What we try to do is meet them where they are, understand their situation, and educate them about it in that fashion.
But if they go to the exchange themselves, will it automatically give it to them for their income? It's not everybody's going to know to call.
Here's my expert.
Yeah, so we give all of our clients, Bill York, the option of which way they might want to apply. Again, we screen for multiple programs, CalFresh, Medi-Cal, Covered California during open enrollment, or for qualifying events, which is any time. And so we will send them to a nonprofit agency or agency where they could work on an application. We can walk them through it over the phone and talk about their subsidies, so we actually have access into the CalHERE system. So we walk them through all the options, and we have the 7 plans that we can help them pick one over the phone. So we have a special queue system that talks about Covered California. We, as the governor mentioned, 72,000 individuals we've outreached and educated, and then we can do the application or whatever way they might want to apply or pick a plan. So.
Clarify the cost of talking about the expansion of 2 different programs, the expansion of Medi-Cal coverage for undocumented youth, and on the other hand, the expansion of subsidies for middle-class and low-income families under Covered California. What are the relative costs of each?
Well, it's $98 million on the expansion in this fiscal year, 0 to 26, and the subsidies, the latest numbers were 400 and, what was it, on the subsidies in the middle class in the current fiscal year?
How many?
What's the cost in the current fiscal year?
400, about 450, 460.
Yeah, in that 450 range. But let me just make this point, and the Pro Tem was making it. I love that she made this. Historic rainy day reserves paid off 100% of the debt we inherited from the previous administration 8 years ago. $34.7 billion we inherited debt. All of that was paid off this year. We're using $9 billion over the next 3 years of the reserve to pay down pension obligations. Find me a state in America that's using general fund surpluses to pay down pension obligations. The Pro Tem mentioned a number of additional reserve accounts. Don't for a second lazily say we have $19.2 billion in reserves. That does not tell the whole story. We've created all of these other reserve accounts. This state is in remarkably good fiscal health. I contrast that with the state of our nation, with this incredible recovery of which a quarter of those jobs are emanating from the state of California. They can't seem to balance their damn budgets. Out here in California, we're not just balancing budgets, we're setting aside historic amounts of money for an inevitable downturn in the economy as we expand these subsidies, as we commit to do more for the most vulnerable in the state. I don't know, I'm just proud of that. And I think Californians of all political stripes should be proud of their state at this moment.
Governor, you mentioned universal health care. How do you get there, and how's California going to pay for that?
Well, we're doing it. First of all, we have universal sick care, and we're already paying for it. You're paying for it, thank you, in your premiums. I mean, I love everybody running up and down saying, I can't believe we're providing health care for folks without documentation. I said, you're already doing it, but we're as dumb as we want to be. You, for some reason, want to spend 10 times more in the emergency room. I want to spend a lot less by getting someone immunized. I just don't even understand the controversy. I guess people just want to keep spending more money, wasting money, and you just, or maybe it's politics. I think it's a little bit of all the above. A little naivete as well. Some of the journalists out there and some of the networks just don't seem to get it. And forgive me, I'm a little pointed in that respect because there's one network in particular that seems to believe this is the only thing that's going on in California. But that's how you get there. Keep doing what we're doing. Keep plugging away. Keep fighting the good fight against those that want to dismantle and roll back health care with absolutely no idea what to do if and when that happens. With all due respect, God forbid the Trump administration is successful in repealing the ACA. It would be calamitous, not just to this nation, but to the administration, because they have no idea what to do if that happens. So they could demagogue it, I imagine, while quietly hoping that their point of view is rejected. Meanwhile, we're just trying to be a model for the rest of the nation, and we're getting closer and closer every year. And so we'll pay for it within those constraints that we set aside. We're not profligate. And we did it incrementally this year, boldly, but incrementally. And next year, I hope to do the same in partnership with the legislature and the leadership, as long as they concur. I think we're all on the same page more broadly.
Is there a contingency plan that you're all working on in case the courts do strike down the law?
Yes. That's, see this young man here? That's his job, is to game that out. And we are. I mean, we're doing that on I don't know, we're up to 50 lawsuits or something. And we're gaming a lot of things out. This attack on CalFresh, I mean, obviously, you know, I mean, it's a golden oldie. Talk about an old record. You know, it's like, you know, it's like that dog won't hunt, is the way I would phrase it, in terms of just using food stamps, CalFresh, as a scapegoat to say that's how we're going to balance budgets. That's what they're trying as well. So we're trying to game that out. I mean, we've got a lot of real things that we're trying to figure out in that respect.
For years, we've been trying to communicate with the Hispanic community about the necessity to preventing healthcare, trying to avoid going to emergency rooms for years. And unfortunately, always something comes up like fear. In this last couple of years, fear has been overwhelming that situation of trying to reach for preventive care. How can we get the trust back in? Can you help us out to do that so we can tell them not to be feared about this situation and try to get preventive help, maybe with clinics, which is very, very, very productive for undocumented people especially, or people that has not any kind of insurance?
It's a really important and powerful question. I want to give you two an opportunity perhaps to express your point of view, and I'll amplify some thoughts.
Carlos, thank you for that question. I was with a group of San Diegans just last night asking that specific question. What do we do? And they're operating from a place of fear. which I think is the governor's point, is with regard to health care. If anyone's sick in the San Diego community, we're all at risk, right? I think our commitment, certainly at the local level, is to always work closely with diverse communities, making sure that we're focused on public safety, not immigration enforcement. And certainly at the state level, with the leadership of both the governor, the pro tem, and the speaker, we've advanced legislation to make clear where is the right places to do immigration enforcement and where is it not. It's not in a courtroom. It's not in a hospital. It's not in our schools. And so we're going to continue to define that, I think, to make sure that people understand that what we are as a state, which is that we value our diversity. We understand that immigrants strengthen us. But that fear is extremely real. And I certainly invite any San Diegan to contact my office to let me understand what more we can do to communicate that safety that is so necessary, not for their well-being only, but for our collective well-being as a community. We, in 2017, experienced a hepatitis A outbreak in this county. 20 people died, over 500 were sickened. It didn't discriminate on your immigration status. Everyone was in fear. That's exactly what we're trying to prevent, and the investments we're mentioning today is a step towards making sure public health crises like that are not replicated going forward. I don't know if Senator Atkins has more to share.
Carlos, the only thing I would add is I think our community has seen evidence, not just in San Diego County, but in the state, that we want them to seek out health care. No one is more vocal than our governor about what our mission is to serve the residents in our state, all of the residents. So, point in case, the migrant shelter. Our community stepped forward. Our nonprofit organization stepped forward when the federal government refused to do their responsibility. The governor stepped in. And then, of course, with that visible show of support of how we were going to support those who needed health care, La Maestra, San Isidro, and then Jewish Family Services, and that is a prime example of how people knew that they could count on us to come together and find a way to provide the support. And I think the message is very clear. You hear it every day from us, our commitment. Having said that, you understand why people are still afraid. You understand why people are still afraid, but I think we are visibly showing how to help people get those services regardless in our own community and in our state.
And I can't encourage people more to get in that clinic, get that immunization shot, send their kids to school. You know, I don't want to get into a sanctuary policy debate, but I will say this. What's often discussed around sanctuary policy is a frame of public safety, but not public health and education. I've long believed it's a three-legged stool, sanctuary policy. It makes people more likely to drop their kids off at school, not worrying that the school crossing guard is collaborating, coordinating with federal immigration enforcement. You're more likely to get your kids immunized if you're not concerned that that security guard in front of the clinic is coordinating, collaborating with federal authorities. That's why sanctuary policy is so important. We have it in this state. We've long supported that policy for many reasons, not just public safety. And I want to just encourage folks to be reminded of that, or encourage you and others to remind people that there are protections. And in this state, we're doing as much as we possibly can to push back and address that climate of fear that is intentionally being advanced by this administration. And you needed no more evidence than that, than on the first day of school, that hundreds and hundreds of kids were left without a damn parent because this administration assaulted those families in one of the largest raids we've seen in my lifetime. There's separation at the border, and there's separation of kids in states like Mississippi. Both are equally disgraceful. He should be ashamed of himself. Well, these guys have been extraordinary leaders in this space, and they're working on over a dozen, maybe 24 bills, and I'm looking forward to getting as many of those bills on my desk as possible, because good enough never is. We have a lot more work to do. We also have work to do in the courts. We have a large capacity magazine ban in California, which is one of those common denominators in many of these mass shootings. That's tied up in the courts because of National Rifle Association affiliates. We have a background check system on ammunition that just in the first few weeks of its implementation last month had 100 folks that were illegally trying to buy ammunition. Otherwise would have been able to access that had we not had that law. Now they're trying to sue to stop the first in the nation ammunition background check system. So we'll continue to fight in the courts, and we'll continue to do more on red flag laws, on other means and mechanisms to make our citizens more safe. I should note, California's gun safety laws have outperformed the rest of the nation. Gun safety saves lives. California, Massachusetts are leading this nation at scale with gun safety legislation, and it's point of pride, and it's been a 2-decade trend line that deserves to generate some headlines.
And then just to follow up on that, a 19-year-old who shot up a synagogue here in Poway, he purchased his gun with a hunting license. And the new state law in California says you have to be at least 21 to buy a rifle or a shotgun, unless you have a hunting license at least 19. Do you think that's a loophole there?
We're looking at that.
It's your leadership.
We've already noted that, and there may be legislation to close that loophole by the end of our session that the governor will hopefully sign.
Those are, I mean, if you can't even get a drink in a bar, enough said. Anybody else?
I'm on the board at 211 here in San Diego, and we know that 80% of all the healthcare outcomes are related to social issues. The reason that we have 211 is to link those social determinants of health, that's the bottom line, to try to support the people that need it the most vulnerable. Many people don't know we're a nonprofit. They think we're a governmental entity. They don't realize that we rely on community support. How do you, since you don't really see these growing all over California, how do you see
yet.
the need to incentivize this type of collective thinking in communities? Because what we're really moving towards is population health and taking care of the most vulnerable people who really are the highest impact on everything else.
Yeah. I think you may know the answer to your own question. Look, it's at the end of the day, there's no substitute for leadership, not just statewide leadership, but leadership at the local level. Success leaves clues. You've been leaving a lot of clues, this 211 Center. And so we need to export your progress, your success, and work with CSAC, which is our county affiliates, and other city leaders, and encourage them to come down here if they haven't, learn more about what you're doing, and see if they could patch together the resources. And we've been working. I give Supervisor Cox a lot of credit for his advocacy in this space. He's been pushing me and others to see what the state can do as an overlay to help incentivize and leverage dollars at the local level, and see if we can match those, the private sector and NGOs, to make real what you're doing down here.
Governor, you talked a lot about costs today in healthcare, bringing that price down. One of the things I think we could talk about is also the cost of living, especially in San Diego. There's that bill, I think it was cap rent increased 7%, if I remember that correctly. I mean, that's still triple wage. That's still triple wages. Is that going to do anything?
Yeah, I made a comment. I think we can do better. And we are deep in negotiations and discussions to see if we can actually bring people together around that, so it's not just platitudes. We need to do something, not just on production, which we are rightfully focused on, and we'll continue to hold government accountable. I want to give you credit, though, City Council and the mayor down here. I'm not kidding. I've been impressed, and I don't care about politics in terms of who's on what side of the aisle. You actually are doing a really good job down here, and I applaud the leadership of the city. And I hope that progress continues many years. But there are other communities that have no interest in doing what San Diego is doing, and that's doing more on the production side. But it's not just production, it's prevention. We've got to focus on keeping people in their homes. We were really privileged 2 days ago to present a proposal to the legislature to put $331 million aside, create an annuity that would provide ongoing funding regardless of any macroeconomic downturns for legal aid to support those that are on the verge of being evicted. But we have to do more, and that's why this rent cap conversation is generated a lot of interest in the legislature. It not only generated interest in Oregon, it became law in that state, but I think we can do a little bit better than Oregon did as it relates to advancing that cause.
Going back to healthcare, can someone update us on the most recent enrollment rates for Covered California
They did take a hit, but in a much lesser degree than we saw across the nation. So in Covered California, we had a reduction in enrollment last year. I can get you the exact percentage. But we're confident as we've looked forward to this coming year and this October that as we've reintroduced the individual mandate in California, we've introduced the subsidies that we've talked about today, that we expect that we'll see an increase in enrollment in a way that we didn't see last year. So we're really looking forward to what this coming year will bring, because we've shouldered 2 years of no subsidies and the removal of the individual mandate at the federal level. So the move of the governor and our legislature and the Senate, I think really gives us a chance to make up some of that lost ground and bring a lot more people into the market that, as we've talked about, doesn't just impact them. It impacts all of us and reduces our premiums and makes it more affordable. To the cost of living question, this is one of the key strategies, right? The middle, when they struggle with healthcare costs above 25, 30% of their income, they suddenly erode, and things like a rent increase, a wage stagnation, it really affects those families. So we're looking forward to seeing the enrollment go up and affect all of California. Yeah, so part of an important part of the move and budget process was both to introduce subsidies at the level of $450 million roughly this year, over $1 billion over 3 years, but at the same time reintroducing the penalty for individuals who can afford health care but opt not to. And frankly, that's an important part of the funding source for the subsidies. So it becomes together a sensible way to encourage people to enroll and supports folks to make it more affordable.
Oh, sorry.
Sorry. It goes into effect this coming tax year. Sorry? What's your name? Sorry. Who is this guy? Yeah, I'm Dr. Mark Galley. I'm the Governor's Secretary for Health and Human Services. Galley, Ghaly, and also the chair of the Covered California Board.
You're talking to the right guy on that topic. All right.